Good afternoon, Senator Gratwick and patient members of the IFS committee. My name is Matt Schlobohm. I'm the executive director of the Maine AFL-CIO. We represent 42,000 working men and women in Maine, and we work to improve the lives and working conditions of all workers in the state. We strongly support health care as a fundamental human right. We believe it should be a public good like public schools, roads, fire, police protection, and not a market commodity. We support a universal, publicly financed system where health care is decoupled from employment. I've provided a handful of supplemental materials in addition to my testimony. One of them is a Kaiser chart showing the economic squeeze workers have faced around health care. Another is a document that extrapolates on a human rights framework that we find very useful to think about with regard to health care. And then there's a public citizen report that looks at, I think in the most thorough manner I've seen, all of the issues that are raised for states when you're trying to design a single payer system, which truly isn't possible on a state level, but it's very close to possible, as they argue. In thinking about establishing a system where healthcare is truly a human right, our work's been guided by 5 human rights principles: universality, equity, accountability, transparency, and participation. We find those to be valuable evaluative tools to look at a system or a bill. And we're strong supporters of single payer, but I would just point out that you could have a single payer system that wasn't meeting those human rights goals with inequitable financing. So I think evaluating any system, including this bill, in that manner is instructive and helpful. A few points on why we're supportive of this bill and supportive of healthcare as a human right. Our members, obviously, the vast majority of them have very good health insurance. But our mission is to improve the lives and working conditions of working people, and working people are facing an enormous economic squeeze in this economy, and healthcare is a core component of that. If you look at the Kaiser chart, what it basically shows is that wages have barely kept pace with inflation, but workers' contributions to premiums and health insurance premiums are basically triple the increase in wages a little over the last decade. And so if you want to address the soaring underlying economic inequality in our society and country, you have to address the healthcare crisis. And another reason we support this is our members often literally work themselves to death. That's perhaps a bit hyperbolic, but they certainly shave years off their life. They work in shipyards, they work in construction, they work in a number of industries where they do incredibly physically demanding work, and at the age of 58 or 61 or 62, their bodies are not ready to continue what they were doing at 24 or 26 or 28, whether they're a UPS driver hauling packages and breaking their back for 30 years, but they are unable to retire until they hit that Medicare age. And I think, again, it's not a rational system. It doesn't make good economic sense. You've heard all the economic arguments for why moving to a better system makes more sense. When you spend 17% of your GDP, it's not good for your economy. And I would just close by saying I think we strongly support this legislation. I think there are some ways to improve it around equity criteria, and those are spelled out in the bill. I think there are ways to improve it around some of the process principles of participation, but we think it's a very valuable contribution and a good step forward, and we'd ask you to support it.